And karibu sana daktari. Let's get
Thank you.
Yes, let's get it started right on. What does a cosmetic gynecology do, or what does it entail?
Okay, so I'll just, because I am a cosmetic dermatologist by profession, and sometimes it can get a little bit confusing. How is a dermatologist venturing into gynecology and
Yes.
this, that, blah, blah, blah?
Yes.
So traditionally, dermatology and venereology are considered one discipline. So venereology is the study of sexually transmitted diseases, because that is also skin. Yeah. So the skin and the mucous membranes. So when it comes to syphilis, gonorrhea, genital warts, all kinds of things you get when you're a little bit too naughty, yeah, you do come and see your dermatovenereologist for it. Yeah. So expanding on this, I was quite interested in the cosmetic gynecology and cosmetic andrology fields.
Okay.
Yeah.
Yes.
So with cosmetic andrology, we're talking about male enhancements. And with cosmetic gynecology, we're talking about female enhancements. Now, what I do is I specialize in non-surgical treatments. Yeah, because as it is, getting something done down there it's a scary thing for anyone. I mean, I do a lot of procedures, but if somebody was to go and poke needles in me down there, I'd be very scared. I'd be very apprehensive. I'd be like, oh, I need anesthesia. So I can understand when you talk about going and getting surgery done over there. You're thinking, oh my God, am I going to be feeling okay? Is it going to be different? Like, what if I lose sensation?
Yes.
Yeah. What if the surgery goes bad? What if I can't have sex ever again in my life? So there's all these scary questions that come to you before you have any cosmetic gynecology or andrology procedures. Yeah.
All right. So what is G-spot enhancement? What is that about?
Okay, so like when it comes to cosmetic andrology and gynecology, what I'll do is I'll just go into the subject. In males, what we do is we do collagen injections to make the head a little bit bigger and to increase the girth. Yeah.
Yes.
So that is done as a simple 5-minute procedure. We inject and it's bigger.
So in 5 minutes,
It will be bigger in 5 minutes?
Yes, the mushroom looks a little bit bigger.
Does the mushroom go down when you're sleeping, or you just be big for the rest of your life?
It will go down when you're sleeping.
But it gets big when you're about to be up.
You're looking at maybe around an increase of 1 to 2 centimeters in diameter. Yeah. So
Is it a painful procedure?
what we do is we anesthetize the same way that you anesthetize when you do circumcision, and then you just inject the head with collagen, and it blows up.
All right. So it's a lifetime guarantee.
So it lasts for 18 to 24 months, and then after that you have to come and have the procedure done again.
Good Lord. So it's a forever injection.
No,
After
you
injection.
have to be coming constantly.
Kind of, but you enjoy, you feel good, you can enjoy looking at it in the mirror,
Alright.
and everything else that men like to do, and so it's quite a famous popular procedure.
So that's for male, but
Yes.
what about
A
female?
moment for men. Is there any side effects to that?
Pain, redness, swelling, bruising, those are the main side effects.
After a period of time, then you'll be okay.
Yes, you'll be okay, because what we're injecting is hyaluronic acid, which is a naturally occurring collagen substance that is found within our bodies. So chances of side effects are rare because of that.
And for females?
Okay, so yes, I started with men because that's very easy.
Yes.
And for females now, we can look at it from the inside or from the outside. But since you asked about the G-spot, that is on the inside. So what we're going to do is the G-spot injection was invented by a cosmetic gynecologist in the US called Richard Matlock. And basically what we do is we help the patient identify her G-spot. Yes, and that is done in the clinic. And then once she identifies where it is exactly, and we help her through the whole process, we help her relax, because sometimes these things are not easy. I mean, some people say that the G-spot doesn't exist. Some people say that it exists. So that in itself can be a conversation, but that is a conversation that is the same as some people can squirt and some people cannot. So the spot does exist, I believe personally, because I have been able to find it during these procedures, and we have had happy clients that have enjoyed better sexual experiences after this procedure.
So if you after you find it, like you know where it is, right? Like the lady goes and you also show. Like
Yes,
you also,
it's in the vaginal canal.
yeah.
On the anterior wall between 3.5 to 5.5 centimeters inside, and this is an average. I mean, everything varies. Human beings are made in different sizes and shapes, and even the G-spot varies. So
So
we
do
help
you-
you find it.
Do you encourage your clients to come with their partners? Because if if I still don't know. She knows now where it's at. So I also would like to know specifically where it is. So would you encourage your clients to come with their partners?
Interesting. I think I will do that from now on. Yeah.
Because it's only you who
yeah,
knows. The
yes.
partner doesn't.
Yes, but sometimes, would you want your partner to know you're going for a G-spot injection?
All right.
I
so-
think yes, because maybe I'm not getting it. I'm not
Yeah, but
excited about
do you
it.
see that? Do you see that hesitation?
Yeah, because if I look at it,
yeah. So everybody's different. Yeah.
yes.
So some people like sometimes when ladies age, yeah, then they start enjoying sex a little bit less.
Yes.
They don't want their husband to know that they're not enjoying it anymore.
Oh, okay.
Yeah. Sometimes the husband says, "Ay, Kwani, now these days you don't feel it like you used to back in the day." Yeah.
Oh,
So there's all kinds of things. Yeah. Sometimes it's a matter of confidence. Sometimes it's FGM. So she can't have clitoral orgasms. So now she wants to try and have a
vagina.
a vaginal orgasm. So there's many reasons. Yeah. And I don't encourage anybody per se, but I will from now on say that if you want your partner to be present, we can have that. But I think once I have taught her, she can teach herself.
And
And
teach
even
someone
teach
else.
him.
Yes,
And even teach
exactly.
him.
And
I have a follow-up question about something you said. I forget my chain of thought. However, if you have come to
the
your
G-spot is making you forget.
No,
Yes, it's exciting, people here.
So if I've come to your clinic and I don't feel quite satisfied because the procedure has yielded results other than those I expected, all right?
Yes.
Say a patient can feel resentment or even anger towards you as a doctor. How do you deal with that? Say I wanted to have these volcanic feeling after a procedure, and then I achieve anything but. And now I'm angry at you. What happens?
Okay, now you see what happens is with any medical procedure, yeah, as much as we try our best to ensure satisfaction of our patients, in some cases, some things do not work. People are different, and in some cases, we don't know why something may not work. They say that 80% of females experience better sexual intimacy after this procedure. Yeah, so that may mean better orgasms, more sensitivity. People are different, so things vary person to person. Yeah, I have had people saying, "Ay, daktari, siski kitu." Yeah, and there are some patients that are over the moon. Yeah, so there is a 80% success rate, and we warn patients that it's a medical procedure. I mean, you can't be angry at the doctor if you get a heart attack and the doctor tries his best, but so we have a human body, and like any medical procedure, there's risks, there's advantages, and sometimes it doesn't work.
Dr. you said something about the G-spot enhancement. There's one that is vaginal and there's one that is outside. Which one is outside?
Okay, so just so that, because there's quite a few things that I do want to talk about, and I don't want to miss them with my train of thought.
Yes.
So I want to go with what we can do within the vagina.
Yes.
I'll talk about the treatments that we do and the treatments that we don't do. And it's nice to see that on KTN they're saying say no to FGM,
Yes.
because it is horrible. The women that I see, the loss of they it's so sad. But anyways, getting back to within the vagina, we have the G shot, and then we have the O shot. So with the G shot, we're injecting hyaluronic acid, which is a naturally occurring substance, into the G shot. With the O shot, we're also injecting, but we're injecting the patient's own plasma. So we get the blood, we centrifuge it, we get the plasma, and we inject that into the G spot. But that I have not seen very good results. So personally, I don't do it. I don't recommend it.
Yes.
Yeah. And then the other thing, the other procedure that we do is the FemiLift or the FemiTite. Yeah.
Yes.
And this is laser vaginal rejuvenation. Yeah. So the laser vaginal rejuvenation is a procedure in which we insert an object that looks like a dildo in through the vaginal introitus into the vaginal cavity, and it fires out a laser beam, and the laser beam causes heat and light energy to cause new collagen formation and tightening of the vaginal canal. So this is helpful in women who have lost confidence after giving childbirth. And the other thing, and this is why a lot of women will come for it, is for urinary stress incontinence. So what happens is, after the age of 50, a lot of women will say, oh, when I cough,
I spill.
yes,
Yeah, I've
a
heard of that.
small amount of dribbling comes out,
Yes.
and this, that, and it's because all your muscles have become weak. So with the laser vaginal tightening, when we do this, we're able to tighten the muscles. And when we tighten the muscles, everything becomes
Tightened. You can't
tightened.
spill.
Yes.
And how, what's the response? Is it more women than men who come through for these services?
Yes.
More women than men.
More women. Yeah. Also, yes. So those are the three things that we do with the outside. So with the inside.
With
Now
the
we
inside.
go to the outside.
Yes.
The other thing that we get some people coming for, especially within the Somali population, is hymenoplasty, whereby after they've broken their virginity, because of the culture, they're required to be virgins when they get married. The man has to see blood on the sheets, and so they come to have it stitched.
Oh,
Yeah.
so my wife was in the Virgin. Good Lord.
We can fake it now. We can fake it.
That's interesting. Oh, wow. Okay, so, Dr. I'm imagining I am a woman or a man, and I'm hearing you on Spice FM. And I want to come for a procedure. I would imagine that there are so many quirks in this practice. Would you have a thing you can tell to a patient who was coming to see you about ways in which they can qualify a surgeon's credentials prior to committing to performing an operation of this kind?
Okay. Now, number one, you want to do research. Yeah. Find out who is your doctor, where did he train, this, that, blah, blah, blah. And you can always call the medical board.
All right.
Yeah, the medical board will give you the credentials. Yeah. But apart from that, like if we're talking about laser vaginal tightening,
Yes.
you can get a laser from China for $5,000. Yeah.
To do it for yourself.
No.
No,
Oh.
the
Yeah,
treatment.
there's some
Oh.
practitioners here, and I'm as a medical doctor, I'm bound by certain ethics because I
Yes.
swore the Hippocratic Oath
Yes.
that thou shalt not speak evil about any other physician.
Yes.
So as much as I can't say anything, this is a very valid point that you raised. Let everybody do research. You want to know for laser vaginal tightening or whatever it is, what machine? Yeah? You want to go, you want to look at that logo. Yeah? You want to see what is it that you are doing to me. Yeah? Before actually getting it done.
Yes.
Because we do the FemiLift and the FemiTight, and we get a lot of patients coming after going to some clinics in the vicinity, and they say that we were told we are going to get a FemiLift done, and we did it, and Dr. it is completely different. I didn't see a change. I paid all this money, nothing happened. And now when I show them the machine, I show them, look, this is Alma lasers, this is luminous lasers, this is the actual machine.
Yes.
Yeah, you can call the company to find out, because now, like for luminous lasers, you even have fakes manufactured in China. And sadly, I'm actually very, very glad that you brought this up, because there are people who, for the sake of unscrupulous profits, are buying these machines from China. Yeah. And imagine putting something from China inside there and telling the public that it is from Israel, or it is from America, or it is from Europe. It is so bad. It is so bad. Yeah. So I urge everyone to do research. You can actually go on the websites of these companies. Yeah. And if you have any hesitation, if you have any doubt, yeah, then you can even contact the company and say, hey, did you sell this machine to this doctor or to this clinic? Yeah. And just be careful. And these lasers and these machines, they're expensive machines. Yeah. So if you're going to a shady place, if you're going to a shady joint, I mean, I can't say that all shady joints based on the aesthetics are going to have fake machines, but just be on the lookout. Be careful.
So, Doc, what is the? I know you said you've sworn, but what is the average cost of some of these things, so that I can start saving if I'm interested?
So the laser vaginal tightening goes for 150,000. There are clinics that offer it for half. I don't know how they do it, but just to let it go out there, they don't. I'm not. Anyways, let's not go there. The G-shot is 100,000.
The G-shot is the one for bigger girth.
No, that's for the vaginal.
That
Yeah,
is
that's
What
for
is
the
the one for the girth?
And for the girth is the penile enhancement.
the one you did.
Yeah.
Domestic.
So, okay, that aside, I saw that you also deal with skin lightening.
A moment before you go to skin lightening. Yes. Between the FemiLift and the FemiTight, which one has more? Which one gives you better response?
Okay, they're both very similar. It's
Yes.
similar technologies, just branded in different ways. As long as you have an original machine, either or is going to be good.
Okay.
Okay.
Emmanuel,
And side effects
All
for
right,
it?
sorry.
Sorry. And the side effects for both? I know that you said for the gentlemen, for the one for the men, and for the ladies. What are the side effects?
The side effects
For FemiLift or FemiTight?
Okay, so sometimes you can get some infection, some pain, some discomfort, which normally goes away within a week.
Okay.
Within a week, you're good.
Yeah.
You're good to run.
Yeah.
So, one more question related to that.
And I haven't talked
do
about
you-
the outside.
Yes, he hasn't talked about
Yeah,
it.
so we can change the topic.
No,
but
no.
No, because I asked that question. Yes, I need
We
to know
won't
about
change
the
the topic.
outside. about
So,
the business.
so after a week is when I can get back to action.
Yes.
And will it keep its elasticity and tightness, or will I have to go back like for the gentleman after 18 months or 24 months?
So for women, once a year we do a touch-up because
Touch up. Are the same amount of money?
No.
Okay.
The touch-up is 40,000 once a year.
Okay.
Because you're aging
Oh, yeah.
everywhere,
Yes.
on the face and down there.
And,
So
yes.
you need to.
And you're also working it down there. Yes.
Yeah.
Well, I'll take you back to the money. I mean, speaking of money, a lot of these procedures have been cited as having huge financial costs. So the cost often goes up with the intricacies of the procedure and also just the experience of the doctor. Would there be alternatives for that high cost of 150? Say, can I come to your clinic for something effective, maybe not for 18 months, but for 6 months, for much less, or I have to pay the top dollar?
Okay.
You know the way you can get nyama quarter? So you're eating meat, yes.
Oh, Lord.
And then the other person will
my
get-
advice to you is, if you're going to get nyama kota for your own nyama,
Yeah.
wait.
Yes.
Wait until you have the right thing. Do things the right way.
Yeah.
Yeah, I'm sure I can. If you go to Mombasa House on River Road, you'll find some people they'll even inject you for 5K.
Yes.
But are you going to put your penis on River Road?
No.
And are there pills I can pop, maybe?
Pills. I mean, you have Viagra, but that's for
Yeah.
male enhancement. But yes.
Yeah. So if you
There's
don't
no-
have 150K, you just wait and accrue the money.
But you see, you're getting confused. 150K is for the
It's
laser
for the
vaginal
laser,
tightening.
Yeah, that's what I'm saying. I'm just using 150 for
yes,
an
150. But
example.
you're talking about the penis
Yes,
and
yes.
pills and things like that. So
No.
let's.
Let me be clear, Doc. I'm saying
Yes.
if I want a procedure, be it a man or a woman, and I can't quite fit the required amount of money, it's best, from your opinion, that I wait and I accrue the sum instead of opting out for a cheaper option.
Yes, I mean, if you want to go to a cheaper place, do your research. I mean, I don't know from what I've heard, because like for the Femilift and the Femitite, I know the agent who brings it into the country. So when somebody tells me, it's such and such clinic that is there, I call the agent. I'm like, did you supply here? And he's like, no. I'm
Then
like, what are these people doing?
I
But I mean, you can't control everyone. And,
Yeah.
Absolutely.
I mean, even Jumia just recently stopped selling counterfeit products on their website.
Yes.
I mean, I'm so glad that this has finally happened, but this was very recent.
Yeah.
Alrighty. You said we've not. We're finished with the inside, right? Can we now go to the outside?
Absolutely.
Yes.
You,
Okay.
you can just introduce it, and then I'll tell you what we're gonna do.
Okay, so when we look at the outside,
Yes.
first of all, we have the shape. Yeah,
Yes.
because after a lot of usage, it becomes a little bit loose. I mean, if you see the vulva in the 20s versus the age of 45, it's lost its elasticity, it's lost its plumpiness. Just like the skin on the face, you start getting wrinkles and sagging down there as well.
Yes.
Yeah.
Doc, does it help before
We
I forget
also
my chain
get
of thought?
we also get some lightening. Yeah.
Yes.
Yeah.
So we can do some lightening for that area.
Yeah.
Yeah, and this is because ladies will bleach or they will get waxing done. So after the waxing or after shaving, you get darkness. So that
Yes.
area is really dark. I'm sure you know what I'm talking
Yes,
about.
I do. Yeah.
Or even after pigmentation, or even after shaving, you get those pimples and things like that, for which you would ideally want to do laser hair removal.
Yeah.
So there's the plumping, there is the pigmentation, and there is the overall cosmesis of that area that we work with. And then we have the C shot, which is the injection into the clitoris so that men can find it easily.
Also, it will swell up.
94.4 Spice FM, Barbara. We're going to come back. Hold that thought. We're going to come back with more of this conversation. Meanwhile, we're going to listen to some D'Angelo. We're here with Dr. Pranav Pancholi, who is, he's just full of knowledge, man. I think we need to have him here for the next 3 hours, man, so we can just get to understand what we're talking about. We're talking about benefits and dangers of plastic and cosmetic surgery. We'll be back. Remember, the hashtag is what?
Adults in the room.
And I'm sure Dr. is also going to share where his clinic is at. So if you want penile reduction like some of us...
And enlargement, like some
there's
people I
another
know.
guy I know who needs
Yeah.
it.
Wait. And how do you know this guy that needs
They met him in the jet.
Nimekushika.
Good question, Don.
No, you guys don't go to the gents. Hey.
I don't go to the gents.
We go, but we don't start looking. We are just digging.
Priscilla Albert from Eldoret saying, enjoying the show. Juliet Chesaron says, conference inside pub. I have my pen and notebook. Nimekwama kwa made in China. Spice it along the way. Saitoti Malloy says, Yani tonight, it's a lesson after a lesson. Daktari, please don't stop.
Daktari has some, followers, man. Thank you so much for the feedback. We were talking about the outside, and you did an introduction. For anyone who's just joined us, maybe you can just very quickly, we just go through it really fast again.
Okay.
Then you can continue.
So when it comes to genital cosmetic gynecology in women, we have the G-spot and laser vaginal tightening, or the femilift or the femitight that we've talked about.
Yes.
We've talked about the hymenoplasty to repair the hymen.
Yes.
And now we're talking about the outside.
Yes.
And on the outside, there are three main procedures that we talk about. One of them is the C-shot. Yeah. And with the C-shot, what we do is we identify the clitoris, and then we go under the clitoris and we inject some medicine. And what this does is it lifts it upwards and outwards so that it is easier to feel. Yeah?
Because men cannot see it, you said.
Yes.
Men
You
are
said it.
blind to the clitoris.
Or where? Or
Men
where
choose
are
to
you?
be.
Yes, that's the word. They choose to.
Yeah, they're very
Selective
selfish.
amnesia.
Yeah.
Yeah, it's like, sijui yo.
Yes.
So it actually does help,
Yes, absolutely. Yeah. And after that, we come to the other problem. Now, this is an extremely common problem. Yeah. When women shave, when women wax, yeah, then they start getting razor bumps. Yeah, they start getting small it's called folliculitis.
Yes.
We get some bumps with pus. You know how men get razor bumps?
Yes.
Yeah, so women get those down there, and it's extremely uncomfortable, itchy, and painful. Yeah. Now, normally for that, what we recommend is laser vaginal tightening. Laser hair removal. Yeah, in the bikini area. So when you do laser hair removal, we have three ways of doing it. Some people just want to do the bikini line. Yeah. Some people want to do the full bikini. Some people want to leave the mohawk. So you do it on the sides, but you leave a little landing strip.
Yes.
Yeah. And you have the Brazilian, where you go pacanuma
Yes.
and you clean all the hair.
Forever and ever?
Yes. So with
That can be fun.
yes, yeah, it's clean. You don't have to worry when you go on a date. Have I shaved or not?
Not, yeah.
You don't have to look down there and say,
You're
hey,
clean.
I'm
Yeah,
clean.
yeah,
You
yeah.
just know you're clean. It even makes the woman feel more confident.
Yes.
Yeah. So for laser
waxing.
hair removal in the bikini area or in the vulval area, what we do is we use a machine known as the Splendor X, and what we do is we destroy the hair follicles, but you need between 6 to 10 sessions, so you need to come once a month. Yeah, and there
That's
are
like 6 months.
6 to 10 months, so you come
Okay.
every month. Yeah, and again with this, you get so many fake people out there. You can even get lasers in spas and beauty therapists and wherever you go. Yeah, and ladies, please don't put your vajayjay in all kinds of disastrous hands and places. Yeah, go to a professional, get things done the right way.
Like the other one, how would you tell the spa is not professional enough? Because you're right, I've seen a lot of info about you can do this in a spa. Like, how would I confirm
You see, it has to be a medical spa.
Yeah.
It has to be under doctor supervision.
Not a salon one, because
Yes.
that is very dangerous.
Yeah, now, look, our salons. Yeah. In fact, overseas, even the salons are regulated. Over here, people just pull somebody from there. They say, you'll be a nail therapist.
Yes.
Yeah.
Ingia fanya kazi. Yeah. So, I mean, it's sadly a situation that I would urge the Ministry of Health to look into. Yeah, because where beauty and medical are getting closely combined, we can even call this area wellness. And I'm on the board of the Spa and Wellness Association of Africa. And this is an area where our government needs to look into to make sure, that, I mean, it could be anybody's daughter. I mean, like most of the people that go to all these spas and things like that, they're from well-to-do families. A lot of them are from political backgrounds and things like that. And I mean, it could be your daughter. She goes there to get her hair removed or whatever, and the next thing is she's burnt down there. Yeah. What I do insist is ensuring and finding out, do they have a ND-YAG laser? Because ND-YAG is the optimal wavelength for dark skin. Let people not cheat you into, I have a laser. What kind of laser? It is called this. You want a ND-YAG laser, and you want it from a reputable laser company. There are over 50 reputable laser companies. Yeah.
But it needs to be for your skin color.
Yes, so the ND-YAG is for dark skin.
For dark skin.
So for Indians and for African skin, you need to have an ND-YAG laser.
Okay.
Is it painful?
It can be.
Yes.
Can be
It
it means it's painful when a doctor is saying can.
You see, people have different thresholds, especially women. Yeah, there are women that will go give birth to look like nothing has happened, and then there are others you'll see them screaming and pulling their hair out, digging their nails into the midwife. So pain is also relative.
These penis and the vagina thing is a big business. People are serious about their genitalia, aren't they?
Yeah.
Yep.
Especially, can a guy do the same procedure? Like just get rid of all the hair?
Yes, absolutely. We have a lot of men that even come for the laser hair removal. Yeah. Something really funny that some of the male patients have told me is, because normally we have very few males that come for it. So it's normally female therapists that have to do it. Yeah? And what this involves is you have to apply an ultrasound gel. Yeah, so you have to apply an ultrasound gel to the whole area, and then you have to slide the laser probe to gently destroy the hair follicles. And while somebody is holding
They
your
rise up to the
instrument,
occasion.
yes, yeah, and then you're moving the laser up and down, up and down, up and down.
It's because you see the ultrasound gel. Well, for a woman they would
Yes.
know. For men they think it's lube.
Yes.
Yes, for women no, it's the ultrasound, because if you've had a baby, that is something they wipe on your tummy.
Now you're
But for-
holding it, you're
so
giving
a
him
man-
lube, and then you're using some kind of heat therapy with the laser to rub. So
I know why
nobody has admitted to an accident, and I don't want to know.
Eric, do you feel like dashing there for that?
No, I was just gonna say that I
Eric
know
is
why.
no more.
I know why those men would do that. But Doc, we are almost going on a break. But when we come back, or if time will permit, I would want to ask: does it help if somebody abstains from sex so that they don't wear and tear down there like they would?
Not necessarily.
You'll still tear and wear
Yeah,
because of
your
age.
natural aging process is going to continue.
Even as worse as somebody who's being pounded hectically often.
When obviously with vigorous sex, you're going to have a little bit more damage.
Yes.
It's like if you go into the sun every day on your face, then you have sun damage.
Yes.
And if you don't go into the sun, then your skin remains better. So it's the same thing. Vigorous sex, a lot of pounding, you're going to get.
All right.
But
Absolutely.
it does wear and tear affect guys.
Yes.
It does, yeah.
Your age, it will become droopy.
And we'll ask about blue balls when we get
Yeah,
back.
we will. This is Spice FM 94.4 right here in Nairobi. We're having a conversation here with the good doctor, and it is 9 o'clock.
Sugar and spice and everything nice. Sugar and spice and everything nice.
spice up your life. They are smart, they are funny, and unfailingly entertaining. They are the adults in the room, and they are here to help you be the best adult you can be. Whether it is matters of the heart, finances, or work that's weighing on your mind, worry not. The adults in the room will help you stay winning. 94.4 Spice FM, Nairobi.
Adults in the room. It is 9 o'clock. We're in studio with your favorite people, Eric, Barbara, with myself, Emmanuel. 94.4 in Nairobi, 96.0 in Nakuru, Kisumu.
102.5.
Malindi, 87.9. Thank you so much for tuning in everywhere. A big shout out to my matatu and taxi people, Kina Matthew. But I've not heard from Matthew in a while.
He was online yesterday.
Oh, he was?
Yes.
Matthew, a big shout out to you and everyone who plays this station in your taxi and your matatu. Thank you so much.
That is absolutely right. We celebrate and thank you so much for finding time to listen. Dr. is dropping very, very heavy gems. Calvin Juma says the show is quite lit. I'm listening from the great county 001 on Mombasa. The Menace says, locked in from Bamburi in Mombasa. Quite an interesting conversation. Thank you so very much. Dr. before you came in, as I was waiting, we were waiting for you. I was telling my friend Barbara and Emmanuel here that I once went, I was living in South Africa, and I was born with these semi-red. Can you see my lips, Doc, from where you're seated?
Yes, absolutely.
Yes, so I went to see a dermatologist. So I was born like that. So my friends would always make fun of me.
You know there are two kinds of lips. Which ones? The ones up there?
No, the ones up there. so my friends would
Forgive my
always...
humor.
He's used to seeing both.
my friends in primary school would make fun of me and say that I used to take changa in my mother's tummy. So I was upset, and when I could gather some money together, I went to see a dermatologist in South Africa who was consistently refusing that I'm from Nairobi. She'd say, how is Lagos? So I'm like, I am from Nairobi. It's like, oh, so Lagos is in Nairobi. I'm like, oh my goodness. So she used to like to think that I'm Nigerian. So this woman gave me some lip balm to apply after taking a hefty 600 rands from me twice, which was 1,200 rands. And then her prognosis was quite bizarre. She said that the sun sits on my lips. That's why they are burnt. All right?
Okay.
The sun sits on my lips. So I was asking her, so why they have to surpass my nose and then go to my lips for them to be burnt? But that's a story for another day. Where I was going with this conversation, I'll come for your feedback in your office.
I was wondering.
Yes.
Like,
Where I was going with this, Emmanuel was asking before we went on the break about, I forget what you asked, but I said I would ask about blue balls. Is that genuine or men make it up? Is that medically proven?
What do you mean by blue balls?
Like they've not had sex, so then their balls are blue.
Okay, so you see, what happens is we are regularly producing sperm, yeah? And it is constantly being produced, and when it is produced in excess and you don't have an outlet, then you get a wet dream and it comes out because more is being produced.
Yes.
So, yes, I think blue balls is more of a term, if I'm correct, that is used to understand a woman that plays with a man but doesn't allow or help him to ejaculate.
Yes.
So, it doesn't make them blue.
Yeah.
But yes, it's just... it's a term to say that they're blue because they were getting choked and they didn't get to release themselves.
Okay.
Doc, I have a question just before we pick any calls. Actually, the number to call is 0719-012-600. But you were talking about the tightening of the muscles because, of course, with age and with women, we loosen up. Does kegling help as much, or
Absolutely.
this is more like kegling?
No. In fact, what we do is we always recommend that you do Kegels exercises with this. Yeah? So that also has a very strong part to play. Yeah? And as much as we talk about all of these sexual procedures and things like that, I just want to remind our viewers, that sexuality is not just related to the genitalia. It is very much in the mind as well.
So do you think size really matters?
Okay,
no.
For men or for women?
Thank you. I was going to ask him the same question. That's like, we're talking about men or women.
For men.
Yeah. I mean, you see, you have the average size, and God created that with a certain specific reason. I mean, there's some people that have extremely small, and there's some people that have extremely large. Like one of my patients, she came to me and she was like, "Ay, Daktari, please help me. My man is too big. The moment he comes near me."
Was her name Agnes? Just to be sure. I'm just checking to see if
You
it
know, we're bound by
That's his
doctor
previous girlfriend.
patient
It's somebody, that's the previous
confidentiality.
girlfriend he had.
I was checking if it's my girlfriend. But
Yes, Agnes.
Just
Okay. So you know. I thought you were married.
You know why she left, right?
No, you know.
So you were saying?
Where were we? I lost my train of
One of
thought.
your
with-
patients
One of
came
your
in.
patients.
It's too big.
Yeah, she came in saying that it is too big, and she's like, every time he comes close to try something. I think they got married and she hadn't tested the machine before. So yeah, she was like, I just cringe. I'm so scared. Yeah, and I was like, you need to go and see a surgeon for that. I'm sorry, darling. I can't help.
Yeah.
Oh, that's beyond your scope.
Yeah.
All right. Could you would you help with erectile dysfunction?
Yes, erectile dysfunction. Yes.
Is it a surgical procedure or more of like a mind thing that you help someone or some tablets?
Yeah, like how do you get that? Like what do you do? Do you inject something? Do you massage the area? Like in a nutshell.
I'm asking for some friends around here.
Okay,
I'm
so now
asking for
I
some
see
friends.
now the roasting has come this side.
Dom was very brief there.
Yeah.
Yep, I did do that as well.
Yeah, so most of the times what we like to do is we like to do a comprehensive assessment. And one of the companies that does this in a very good way is called Cenegenics. www.cenegenics.com. And they have a whole anti-aging and youth vitality program for men. Because there's two main things. Okay. There's actually three things, yeah? It's I would like to call it the power, the passage, and the passenger. Yeah? So, if you don't have the power, yeah? That could be either psychological or it could be because of the passage. Yeah,
Yes.
which is the blood supply to the penis. Yeah, and there could
Yes.
be reasons. So when you give things like Cialis, Levitra, or Viagra, what you're essentially doing is increasing
The flow.
the flow of blood, and you get a healthier erection. And then the passenger is the amount of testosterone that you actually have in your body that is going to bind to your molecules and create the sexual tension. So erectile dysfunction requires some blood tests and things like that. So you do the blood test, and then based on that, you would advise a person as to what he needs to do exactly.
So it's not a surefire solution. Like I won't come there, it's not working, and I leave. It's functioning properly.
I would say in 80% of the cases, yes. But sometimes even medical science has not been able to find out the cause of things. And sometimes a lot of these things are psychological. I think as men, there's been times when for whatever reason you could be stressed, you've had a bad day at work, this, that, and you don't feel like performing. And it's very common to... So you can't really just say that... so you have to understand what the problem is.
Doc, is it possible to do a procedure to make men delay so that they last longer? Because that's been a serious problem. A lot of our callers say they arrive too quick.
Okay. Yeah, so I'm sure you will agree with me. Number one, all of you men out there, yeah, all of you, do more foreplay.
Yes.
Yeah, foreplay is going to calm your own nerves. Huh? Hii mambo ya get excited, unaingia haraka haraka na unatoka haraka haraka, should
Exercise.
stop.
Yes.
Yeah, so go slowly, enjoy the moment. Yeah, enjoy the kissing. Look at the beauty of the breasts. Yeah, look at the body. Yeah.
Yes. Yes.
Now, why are you guys laughing?
Exactly. I'm not even understanding why they're laughing.
it's
though.
funny.
Yeah, it's you see, these are the men. These are the men that don't look at any of these things.
Yes, then they
When I
find it
get to
amusing.
then they say, why am I firing so quickly?
I also
So
wanted to ask.
foreplay will
No,
help.
are you done? I don't think he was done.
I was interrupted,
Yes,
but
yes, go ahead.
yeah. So foreplay is going to help. Yeah, and apart from foreplay, you have other aids as well. Yeah, one of them is men can also do a Kegels exercise. Yeah, you know how like when you have to go and pee and then unaji kaza tu cha. Yeah, you're clenching the muscles around the prostate. That's similar to the Kegels exercises in women. Yeah, so if you do that 20 times a day, when you get that feeling where it's coming, and you just hold it tightly, it will not come out.
20 times, Eric.
Yeah.
You've had.
Yeah, 20 times. Yes, unajikaza every day, and it'll take you 6 months to a year to develop that kind of control. Yeah. Then the other thing is Viagra and Cialis. They also help to delay ejaculation, and the other thing is you can use local anesthesia. Yeah. So even if you apply Bonjela there, and by no way am I telling people to apply Bonjela down there, but it has a local anesthetic effect, so it will numb it, so you don't feel it as much, so you can go on for longer, like the Energizer Bunny.
All right. Eric, do you feel helped? Like,
Hey, I can see that notebook. He's writing everything.
Doc, I have a question. There's this issue about, and it's a craze, women squatting. And yes, not every woman can squat. I think many people think, some people say it's an art, some people say it's genes or whatever. Is there a way that through your procedures that can be enhanced, or that is just something that is biological?
There are people that have squatted. I'm also not 100% on this, so I'm not going to be able to give you a fully medical opinion, but it looks like there are certain glands that when get overstimulated cause a gush of fluid to come out. Yeah.
Yes.
Now where, how, this, that, it hasn't been scientifically explained. Yeah. But I am very well aware of squirting. It happens. You can, it's like the woman has just peed. There's so much fluid. Yeah. Yes. So it's hard to tell, but I think even being relaxed, practicing, having the right partner, being comfortable, these are all going to be things that are going to help with achieving. Yeah.
all right, this is 94.4 Spice FM. We're hanging out with our good doctor here in the studio. Eric, is there any action right there?
There's quite a lot coming in, and just a quick reminder to you that we are on Twitter and Facebook and Instagram as well, and our handle remains as always Spice FM KE. And if you're on Twitter, as I know you are, remember the hashtag adults in the room, so we can quickly locate your tweet. I see all of you all, and keep the feedback coming.
Yeah, man, Eric is going to read more of your feedback when we come back. We're hanging out with Dr. Pranav Pancholi. We're talking about benefits and dangers of plastic and cosmetic surgery. If you've just joined us, this is a show that you cannot miss. If you know the words to this song, you have to be 30 years and above or a serious old school connoisseur. You know, this song reminds me of the movie Bodyguard. If you've not seen that movie, you better go check it out. Whitney Houston starred in there alongside Kevin Costner, and it was one good movie. I remember it till today very clearly. It is 20 minutes past 9 o'clock. We are the adults in the room. This is 94.4 Spice FM. I'm in studio with the usual suspects, Eric, Barbara, with myself, Emmanuel, and today we have a special guest, Dr. Pranav Pancholi, who I saw Eric taking his number, and I'm sure he's made an impact in the studio. And
Why are we roasting our poor friend here?
No, I'm gonna take your number too, Doc. Man,
Emmanuel is passing hints.
In his passing hints.
It's indirect.
I'll take his number.
Before you came, they'd already said there's the problem of enlargement.
No.
Before Emmanuel proceeds, there has been a competition that Emmanuel has won over 15 times. So I was trying to urge him.
What, premature ejaculation?
The Doc is also throwing bars. So we're together till 10 o'clock, and thank you so much, Doc, for making the time, man. Barbara, are you seeing anything?
Yes, I am. There's a lady called Pam Okech who says, Doc, how would one take care of a depressed VJJ? You will answer that. And then Carrie Joffrey says, I am tuned from Kiko Bay. He was even having Nyamachoma, now he's listening.
All right. I see you, James Mwangi and Jumbo H. There's also Chris Panas, Winjila, thank you so much. Nicholas Onyango, Juma Bon, Juma, Mary, and Karanja Gladys. Thank you all so very much. Remember, we are here all the way to 10 o'clock with Daktari. And if you have any questions you want to call in and ask, the number to call is 0719 012 600. You can also do the same via Twitter, Instagram, and Facebook. And Daktari will gladly answer your call.
Let's pick up a couple of phone calls.
So are we answering the question about the depressed vajayjay first?
Yes.
Answer that question.
Okay, so what do you mean by depressed vajayjay? Is it the outside? Is it the inside? Is it
She wasn't specific. She says
or is she depressed, which means that she
it's
just
from
doesn't
proper
feel like
panel
having sex?
beating. It's from proper panel beating.
Oh, panel beating.
Yes,
Oh,
that's
okay,
what she's
okay.
saying.
So then what we have to do is we have to look at the vulva. We have to assess the vulva.
Yes.
And then what we do is we can do some collagen injections into the vulva, and what that's going to do is it's going to plump it up so that it looks like a nice 16-year-old. Yeah. Not like elephant ears.
Yes.
Yeah. And then if there is darkening of the vaginal area from waxing or from what is the other thing they do?
Shaving.
Yeah, from shaving, and they have those razor bumps. Then we can do laser resurfacing for the area to make it nice and smooth and look good. And so we can spruce it up in those ways mainly.
Asking for a friend and for myself, how much will that cost?
So it depends, but I mean, treatments would start at like 30,000 onwards and can
Yes.
go all the way up to 100 to 150,000.
So it's like not something instant, but gradual treatment?
Some things are instant.
Oh, okay.
Yeah.
Like the smooth looking skin and sugar plum is instant?
Yes.
Okay.
Yes.
Barbara, that's the one you'll take.
That's the one I'll take.
Doc, is there any...
And how do you know?
As you've noticed, Emmanuel seems to know everyone's business. From the small ones to the big ones to everyone's problem. Now you know why he's seated on that chair.
Doc, now, is there any solution for this? Like some have a smell.
Smell who? Men or women?
Men, I mean women.
Women.
Sorry, women. There's some ladies have a stronger smell than others.
Okay, so now, everybody has a smell. Yeah, men, females, and some of this is related to natural pheromones, which we as human beings have forgotten about. Yeah, so now because of media and this, that, like, ew, that has a smell, this, that, blah, blah, blah.
It's fishy.
Yeah, but now there is a natural smell that is supposed to turn you on, both for men and for women. At the same time, the quality of the discharge varies depending on their menstrual cycle. So, because of that, even the smell, because of the discharge, will vary depending on the menstrual cycle. However, like as you mentioned, a fishy smell, a strong fishy odor is characteristic of a possible sexually transmitted disease.
Yes.
So that is something that you do need to look at, but you also need to be able to know what is normal and differentiate it from abnormal.
Yes.
So there's no like, if someone is not very comfortable, say with a certain smell, is that where you can reduce it, or we just have to understand, like you've said, that it's because of
I
the
mean,
cycle?
you see, if you're not comfortable with your partner's smell, then you should talk to your partner about it. For men, you can shower, you can clean up, you can use some shower gel, and for women, the same. You can use vaginal douches and things like that. But I highly recommend that you do not do that, because you're introducing all these chemicals inside, yeah? And when you introduce these chemicals, you disturb the normal bacterial flora in the vaginal cavity. And this leads to yeast infections.
Yes.
So when you do all these douches and things like that, a lot of yeast infections.
What do you think of the homegrown solution of putting in yogurt?
Absolutely. Yogurt will restore all the bacteria back. So yogurt you should do, like if you take antibiotics, then after
Taking
that...
yogurt or
No,
inserting
applied.
yogurt?
Applied.
Oh.
Applied inside.
Flavored or natural or plain yogurt?
Just plain. Just
Okay.
plain. Flavored means chemicals.
Okay.
And we don't want chemicals inside there.
So you said it restores all the pheromones.
No.
What
So
is-
you have bacteria and you have fungi in the vagina.
yes.
When you take antibiotics, you lose the bacteria
Yes.
because so the fungi start growing excessively. And when the fungi start to grow excessively, then we have the yeast infection. So in order to counteract that, you add bacteria by putting yogurt inside. And yogurt is very healtty bacteria, lactobacillus.
All right.
But Emmanuel, you cannot put yogurt
Get
on
on
your
yours, please. Make sure it's not yours.
I just wanted to make that clear, though, because Emmanuel is quite adventurous.
Yeah.
Doc, instead of yogurt, can someone use mala?
Yes,
does it work the same
mala
thing?
is fine.
Yeah, because of
but
the lactic acid?
Yes. Lactic acid is produced by the bacteria lactobacillus.
Yes.
So it is completely okay to use. However, you're better off using natural home yogurt, which has less processed yogurt in it.
Oh, okay.
Pineapple, does it help? Does it enhance the
Now
taste?
you
Emmanuel
are-
is very adventurous.
you
Doc.
want to put pineapples down there? What do you want to do?
No. You eat pineapple, and I heard it affects the the taste.
Yes. So you are what you eat. So depending on what you eat, that is going to affect the genital area in both men and women.
Yes.
And research has shown that vegetarian sperm, and I'm vegetarian, just by the way,
Yes.
is sweeter than non-vegetarian sperm.
That's,
Watu wa nyama mko na shida. Eric is in shock.
No, I'm...
His voice has changed.
His voice
He's going to the market to buy some vegetables.
is more, but he's more. These days he's turning into a vegetarian. So he's actually happy with himself right now.
Yes.
Okay.
One more question before I pick up a phone call. Sexual transmitted diseases, you can get it through even your tongue, right?
Yes. So sexual transmitted diseases are spread by contact. Yeah. And there are certain diseases like herpes that are like orogenital cross-contamination. So yes, you can get sexually transmitted diseases from oral sex. Chances of transmission of HIV and things like that is very minimal. However, I would urge the audience to always be safe.
All right, let's pick up a couple of phone calls. 0719012600. Remember to switch off your radio. We're here with Dr. Pranav Pancholi. If you have questions for him, now is the time to call. Let's talk to Charles. Hello, Charles.
Hello. How you doing? Good evening.
We're
Good
good.
evening.
How are you doing, brother?
I'm doing great.
All right, talk to us.
Say hi to our doctor.
Hi, Charles. How are you?
I'm doing fine, doctor. How are you doing?
Good.
I really appreciate it today. I mean, you've brought it. Thank you, Eric and the Spice FM family. You really brought it at the right time. Tomorrow is Valentine.
Oh,
And
yes,
I hope
it
as
is
a part of-
Valentine. So be safe, guys. Play it safe tomorrow.
And as a part of gift, I hope someone tomorrow will learn this and bring a gift to the wife tomorrow on the bed too.
Yes, absolutely.
I just wanted to point out something that Barbara asked
Yes.
about squirting. Squirting. I've come to learn that it's an art. You have to learn it yourself when you study your woman, because there are certain positions
Yeah.
that when you try out, I've tried it out, and every single time I tried out, every time the woman will squint. Even when coming to the oral sex, she'll always squint. And there's a position whereby a woman can lift her leg and then she lies on her back. Then you try to put the leg on your shoulders and then press a little. It exposes the vagina, and then it's easy to access the G-spot very well. And she will squint no matter how many times. And that you can even, after the session, you can go even to the club and come back at 4 and still find your woman sleeping because she's so much satisfied and sleeping like a baby. Yeah.
All right, Charles, thank you for...
So when it comes to squirting, as I mentioned, the exact mechanism by this is not yet scientifically proven. As I said, it does exist. There are these glands, and it depends on the stimulation. It depends on how relaxed the woman is as well. Yes, and in some cases, it is a very mechanical phenomenon whereby women who know how to squirt, when they are touched in a certain way, will have huge, immense ejaculation orgasms. Yeah.
Now, Doc, now that we only have you for 29 more minutes, I have to ask you about skin lightening, because many people are doing that right now.
Okay. So skin lightening
Yes.
is a very good topic to discuss because it has plagued our Kenyan society. Yeah. And why do people lighten their skins? Number one. So in North America, the tanning industry is $1 billion industry. In Africa, the skin lightening industry is $1 billion industry as well. And what happens is human beings want to look different. Yeah. So when everybody's white and you look brown, you stand out. Yeah, you look different. You're going to get more attention, this, that, blah, blah, blah. And when everybody's black and then you're brown or you're light,
You get attention.
you get attention, you move up the social ladders, men notice you, this, that, blah, 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 blah. So there are certain psychological reasons why people want to look different. And as much as skin lightening is not something to be looked down upon, we have to understand that people want to look different. It's just like how people use makeup or foundation or things like that, yeah? But you have to do it in a very safe way. Safety is of paramount importance. And all of you people who are going out there to Mombasa House, yeah? On River Road, yeah?
yes.
You guys know this place. You know it very well. And you go, you get those mkorogos,
Mkorogo.
yeah? I know about these things not because I go to River Road. I get patients from there, yeah? They have stretch marks. They have redness. You've seen those Congolese ladies, yeah? They look like tomatoes, yeah? You don't want to look like a Kenyan tomato, yeah? You want to embrace your natural skin tone. If you want to lighten it by a few shades. And whatever you do, for Christ's sake, do it safely. Yeah. Do not go out there and get the wrong thing. We have safe skin lightening procedures. We have creams that are available in the market that are also safe. Makari is one of them that I've come across. And sorry, I know I'm not supposed to talk about brands, but I just want to make sure that people use something that is safe. Yeah. So yes, please make sure that you're safe in everything that you do.
Is it the same as, tomato crystallization?
So crystal tomato is
The one that ladies use to just change their skin?
yes. So crystal tomato is a supplement that is. Yes, it is sold at my clinic. I was trying not to be commercial, but
sorry.
yeah, it's okay. So crystal tomato is an ingredient that naturally reduces the glutathione, naturally increases glutathione in your body. When you have high levels of glutathione is a powerful antioxidant. So apart from reversing the aging process, it acts as a natural sun protectant, and it helps to lighten the skin, even out the skin tone. So it can be used for dark knuckles and all kinds of things.
Dr. There's a gentleman called Juang Jefferson who asks, Doc, can you increase libido by use of dopamine agonists like bromocriptine 2.5 milligram to be used on alternative days for 10 days mitigate? I think to mitigate the issue of early satiation. Prescribed these to some individuals and it has worked. I have no idea what he's talking about. I'm just
I even
asking.
want to is it a doctor?
Is it a doctor?
He says he's prescribed, so he's
Okay,
either a
no.
clinical officer or a doctor. I don't know.
Yes, these are things that we should not even discuss on radio. They're very sensitive things. I don't want people going out there and getting wrong medicine
Yes.
for the
Yes.
wrong reasons.
Yes.
Everything should be done after a medical history,
Yes.
an examination, an evaluation, and then after that, let us do things the right way. You know, Kenyans are known for taking shortcuts,
Yes.
Yes.
and we don't want to take shortcuts.
Alrighty.
Most definitely. Back to the skin lightening. By the way, I'm waiting for a phone call, people. How much does it cost to do the lightening at your clinic?
Yeah, so
And
skin
then how
lightening.
long does it take?
Skin lightening, now it depends. Yeah, we have so many different skin tones. Yeah,
So it depends on the skin tone that you choose to.
Yes, so because you see, you're using glutathione. So at my clinic, and this is very important because a lot of patients come to me, they tell me, Daktari, I did glutathione, but it doesn't work. Yeah, and I'm like, what was the dose? Because there are clinics out there and they give a very low dose of glutathione and they just say, we are giving glutathione. And the lame public just goes to them thinking that, okay, yeah, but
I'll change my color
yes,
immediately.
but we use 6.5 grams of glutathione. It has to be combined with vitamin C. We use B complex. We use stem cell extract, placental extract, and one other thing that I forget, and collagen. Yeah, so this is what we do. Now, the collagen that we give is used to reverse the effects of all these bleaching agents that these ladies have used. Yeah, and once you damage your skin, it is so hard to fix it. It's so hard to repair it. So ladies, please, 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 in this quest for beauty, please do not do the wrong things.
Are there any disadvantage of lightening your skin? Like, for instance, I've heard theories about getting cancer. How true is that?
Okay, so
Skin cancer.
skin cancer, you can get it, yes, when you lighten your skin the wrong way. When you're using mercury and phenols and things like that, when you're using steroids, yeah, when you're doing these things, then you're going to get skin cancer. So then all these possibilities come into, and not just skin cancer, but when you're applying mercury on your body and it's being absorbed through your skin, you're risking your kidneys, you're risking your eyesight, your liver, so many things. So be safe.
Doc, I've been thinking about possible allergic reactions prior to a procedure. Would you advise...
Possible allergic reactions after a procedure, you mean?
After or even before. Supposing, for instance, say a patient who's just about to undergo a surgery would react to materials like metal or latex. Do you have a test to see if they have allergies?
Okay, so
if
you
they
see,
don't know?
in most cases, we ask the patient, are you allergic to anything? Most people have come into contact with latex or metal, but we do ask. But there's no other way of knowing unless the person tells us that they're allergic to something.
Oh, all right. Oh, okay.
Doc, I have two questions from a gentleman called Kyla Patrick from Machakos. He says, is your beard removal or can I remove my beard through laser?
Yes, you can definitely remove your beard through laser. As I said, I recommend the Nd:YAG laser, and it's available at Avenue Clinic.
Okay, then the other one is, does the viscosity of sperm depend on what you eat, or how can I increase the viscosity of my sperm? That's what Patrick is asking.
Okay, so when you ask about the viscosity of the sperm, why are you asking about this? And in what I'm trying to hazard a guess, but in most cases, viscosity is one of the things that is important when you're trying to conceive.
Yes, yeah.
Yes. So when you're trying to conceive, you want to look at the viscosity. So yes, of course, you are what you eat. If you're going to eat healthy, you're going to eat a balanced diet with multivitamins and minerals, and the right ingredients, right protein, carbohydrates, all that, then the viscosity will improve. However, it may not just be linked to your diet alone. There may be genetic factors at play as well.
So he needs to go and seek medical attention or see a doctor for that.
Absolutely. But eat healthy. It will definitely help increase the viscosity, and hopefully we'll be hearing that you have a child soon.
Yes.
All right, that's good. Tell us a little bit about Botox.
Okay, so Botox. Botox is a very common procedure. I did at least 8 to 9 procedures. I mean, if you look at my Instagram, hashtag Donny Pancholi, DONYPANCHOLI, then what you will find is that I'm always posting a picture, at least 1 or 2 a day. Normally I get so busy I can't even post. But yes, I do at least 10 patients a day. So that's 3,600 Kenyans minimum in a year.
Oh.
Yeah. So it is a safe procedure. We use it for fine lines. We use it for wrinkles. We use it for migraines. We use it for underarm sweating. We use it for people with sweaty palms. So when you have, you know, when you shake somebody's hand and you're
The
just
people
like,
with-
"Aye."
yes.
So we inject Botox into the palms. Botox is used for cerebral palsy. Botox is used for neurodegenerative diseases. So there's over 40 uses of Botox. It's even used for squint, to correct people's eyes when they have squints. So so there's over 40 uses. It's used for bladder dystonia. It's used for anal sphincter malfunctions. Yeah, and it is a very, very safe drug used for all of these things. The media, people get scared. They say Botox is bad, this, that, blah, blah, blah. But it's very common. In the US, where they have statistics, in 2010, 11 million people performed Botox. So it's a very safe procedure.
So if I sweat too much under the
Yes, the underarms, yeah.
so how is it administered?
So we apply local anesthesia cream in the underarms, wait for half an hour, and then using a very fine needle, we inject micro droplets of Botox into the underarms.
All right. So is that the same procedure of administering for any other?
Okay, so for the face, then you have to look at different muscles, because what Botox does is it relaxes the muscles, preventing the muscles from moving. Yeah. So if you want to stop frowning, it's called the number 11 that you have between your eyes, or you call it the mother's lines, because the mom is always saying no and she's frowning her head when she says no, 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 no. So when that happens over a period of time, you start developing these two lines over here, and these can make you look angry even when you're not angry. So what people may ask is, what has happened? Yeah, why are you looking angry? And the answer to that is Botox. So you smoothen it out, because they can be like, "Mommy, what happened? Why are you
Upset, and you're not
Yes.
upset. Yeah.
Yeah, that's a very common thing. "Mommy, why are you upset?" Or even at work, people will ask, "Hi, Kwani, you've had a bad day today or what?" And no, it's just
Can it also correct like eyebrows? You know, those people always look surprised.
yes, absolutely, absolutely. So you see on the forehead, when you get these lines on the forehead, psychologically that makes you look surprised or it makes you look angry. Yeah. So for that, what we do is we inject a little bit of Botox. It smooths it out. Botox can also be used to give you cat eyes. So basically, we give a little bit, and it gives you a natural lift and beauty related to slightly larger eyes. Like even when you do makeup, you want to enhance the eyes and the lips. So we can do that with Botox, which mitigates the need for lots of makeup.
Makeup. You reduce on the makeup.
Very
Botox is good.
Emmanuel,
I
you
should
can
check.
get some
You think
for the
I need-
eyes. Yeah, for the cat eyes.
I have cat eyes.
You get cat eyes.
Doc, we're enjoying your time with you right here in this studio.
I'm glad you're enjoying.
Yeah, I am enjoying. I think I can speak for myself. Barbara, you look like you're enjoying too, and so does Eric. The hashtag is adults in the room. Remember, we're together all the way till 10 o'clock, which is only around 16 minutes away, man. So we only have this resource here in the studio for this really short time. Doc, you said your handle on Instagram is Doc? What's your handle?
It's
on Instagram?
Donny Pancholi. DonyPancholi. Yeah.
Donny Pancholi. on
Yeah,
Instagram.
and the website is www.aveneclinic.com. Yeah.
That's good enough.
And
That's-
the number is 0714 500 500.
You've heard it from the doc himself, man. One of my favorite jams, Nikita, by Elton John. It's gonna take us.
So we're just
all
taking
the
a
way,
small break.
Yeah, it's gonna take us all the way till the time when we come back and have more of this conversation. We'll be back. I don't know what this song does to me, man. It just makes me feel so good.
It's because you've got an advice today. And tomorrow is Valentine's. So I'm seeing you not
you-
going for the men's conference.
No,
Your Valentine is going to be very happy tomorrow.
Yes.
Man, we are the adults in the room. The show is the station is Spice FM. The show is the adults in the room. The hashtag is the same one, adults in the room. Eric.
That is absolutely right. And thank you so much for all of your feedback and questions. The lady by the name Karanja Gladys Daktari is asking, hello, she says hi first and says, is it natural to have very dark knees? Because I have never bleached my skin, but my knees are very dark compared to my skin tone. I have tried natural remedies, but no change. And somebody else once told me that their buttocks are very dark.
Nappy.
Okay.
Yeah.
So we're talking about very dark knees compared to the rest of the skin,
Yes.
and very dark buttocks.
Yes.
Now, for the very dark knees, my first question to her would be, were you a naughty girl in school? Did they make you kneel? Yeah?
Yes.
Because if you're going to be kneeling, because when you have friction on the skin, that induces a process called lichenification. So when you have friction and the skin is getting damaged, it starts producing more skin. And that is known as lichenification, and that causes darkening of the skin. And the same thing with the buttocks. If you're seated in chairs and you're just rubbing your buttocks a lot, then you can get that.
That
Yeah.
explains it.
Yeah.
All right. And is there a way you can fix that at all?
Yes, so we have a cream called cysteamine. There's lots of creams. There's laser treatments that you can do. So we just have to look at the skin. We have to assess it. Maybe we start you off with some creams. I like to avoid hydroquinone. 2% is legal, and doctors can prescribe up to 6%. But I try to use that as my last approach. We
Yes.
want to use non-hydroquinone methods first before embarking on the journey of hydroquinone.
So I think Gladys knows where to find Dr. 0714 500.
Yes.
Gladys, give him a call.
Do you know a series called Botched?
Yes, I'm very well aware of a series called Botched, and it's nice that a lot of people are aware about it. And basically, what is botched? Things go wrong. Yeah?
Yes.
Now, things can go wrong even in the best of hands. Yeah? But chances of things going wrong are going to be more when it is with incorrect doctors, incorrect personnel. So one of the things that I would urge you to do is look at the credentials of your doctor. Yeah, what he did, where he trained, how many years of experience has he had. Yeah, don't just go there because you can go to Dubai, go do a Botox course in a weekend and say, hey, I'm a Botox specialist. Yeah. No, you want to know, does the person understand the anatomy? And most importantly, what differentiates a good doctor from a bad doctor? Because any doctor can inject, yeah? Is what happens when you get a complication. A good doctor has been trained and knows what to do in order to, one, prevent complications or minimize the risk when you have a complication, or to treat it effectively so that you don't get to the level of botched.
And is because I heard that plastic surgery is quite addictive. So do you turn away patients?
Yes, plastic, cosmetic surgery, cosmetic dermatology, all of these can be addictive because who doesn't like looking good? Yeah? Today if you did some Botox and everything and you're looking good, even, and everybody's like, oh, hey, you look nice,
You
or
look
when you're
younger.
walking, yeah, you look younger, yeah, or you look handsome, or you look beautiful, yeah. It even makes you feel good, all those compliments, yeah, and it even boosts your ego, it boosts your confidence. So sometimes you can get into this whole thing of more. I want to look good. I want to look better. I want to achieve a certain kind of look. Yeah. And this has been linked to something known as body dysmorphic syndrome, which is a psychological problem where patients are never satisfied. So sometimes a very quick mental state analysis by just asking the patient a few questions like, why do you want this procedure, this, that, blah, 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 and you'll be able to tell. And if you do the procedure on a person that is not suitable for it, yeah, then you're going to end up in problems.
Because they'll come back or they'll accuse you of something.
Yes, and as I like to say, when people want to do, like they come to me and they're like, oh, I want bigger lips, or I want this, or I want this. What do? I say, I'm sorry, I'm not going to do this, and I send you to my competitor. Because when things go wrong,
I don't want you knocking
yeah,
at
you
my
don't
door.
do. I don't want you saying, "Oh, it's Dr. Pancholi that did it." Yeah,
All right, and I don't know if we have time for this, but if I have a big belly,
a
can
big
you
belly.
come through for me, like if I come to the clinic?
Absolutely, absolutely. We have something called cool sculpting, and there is something proprietary that I'm bringing into the country. I was just in Paris 2 weeks ago, and it's called From Fat to Fab. So what we're able to do is convert your fat into a six-pack. Yeah, but until that technology comes, we have something called cool sculpting or Clatu, and what we do is we apply these hand pieces on the abdomen, and what it does is it freezes the fat, destroys the fat cells, and the body takes between 6 to 16 weeks to naturally destroy the fat cells.
All right, but do you also educate them about their diets? I
Of
saw a
course,
lady-
of course, of
To
course.
maintain it.
Yeah.
Yes, yes, yes.
Eric, you remember the lady who had gone for a liposuction, but she was
Yeah,
massacring.
she had a monstrous appetite, so she would go for liposuction and then eat her way back into the previous weight.
Oh my God!
So
I
it's
I
different.
actually have friends like that. Yeah, and I mean, I can't do anything about it. I mean, I tell them, yeah, I'm giving you an outlet. Yeah, but if you keep scoffing away, yeah, unhealthy food, of course you're going to put on weight, yeah, and then you'll come for lipo or any of these procedures. What's the point? Just start eating healthy. We also have a weight loss program known as Slender Wonder. It's proprietary from South Africa. You're nodding like you know it.
Yes, I do.
Yes, and yeah, with your smile, I can see that it has worked, and I'm very happy that there's somebody on radio that can smile and laugh and say that I did Slender Wonder. I lost weight, it worked. So, yes, and that is the diet and exercise program. Very little
Yes.
exercise, which
Yes.
is not.
I did it 6 years ago. Actually, immediately after I gave birth, I was overweight, double my weight. So I came to your shop, and I was coming for something else, and you recommended it, and it worked for me.
Oh my God! No wonder I can't recognize you. I'm like, she looks familiar, but you lost a lot of weight. Good,
Now I've
good.
gained
I'm
it
happy.
back. Oh my God, eating too much. I'm one of those friends of
Yes.
yours.
So
Yes, but I did lose. I lost 50 kilos.
I'm so happy to
Lord.
hear
Yes.
that.
Barbara is the first consumer.
Yes, I'm a first consumer 6 years ago.
Wow. 6 years ago, 50 kilos. I'm
Yes,
so
when
proud.
you just come in, those wonder. Yeah, but it's more of diet and exercise.
Yeah.
Yes, yes, yes.
Alrighty, I feel like we didn't have enough time, man. I don't know about you guys. I feel like the doc has so many
Doc has
angles.
to come back again, man.
Doc, you're our official cosmetology doc. So we're gonna be calling you a lot, and you're gonna come back, I'm sure.
So it depends on the after party.
Don't worry, the gentlemen have been taking notes. So
The after party has to be cool. Eric, do you wanna thank our guest?
Doc, thank you so very much. As Emmanuel has said, we were strapped for time, but I think we need you more and more. And I see a lot of questions coming still on our social media handles, which I will push to you. And also we'll share your number so that these guys, many of them, can call you. But thank you for finding time. I know you had a surgery and you finished and had to come here, so we don't take it lightly. So thank you. And I hope to see you again. So.
Yeah, man. Finally, for the last time, your handle on Instagram?
So my handle on Instagram is Donny Pancholi, and the clinic is Avane Clinic, AVANECLINIC.com, and 0714 500 500.
You've heard it, man. It's up to you now to take the action, man. It's been a good conversation right here in studio. Barbara, straight home?
Straight home. And at 6 a.m. tomorrow, we have the Situation Room. So join them 6 to 10. At 3 p.m., we have the Spice Drive. That is 3 to 7 with our honey voice. And of course, at 7 to 10, we have the adults in the room. So tomorrow, plug into the conversation. Would be happy to see you.
Yeah, man. Eric, straight home, or you have...
Yes, let's do it again tomorrow.
Yeah, let's
God
do it
willing.
again tomorrow, same time, same place. Remember, music all night long. That means you don't have to touch that dial. For those of you who love uninterrupted music, this is your time, man. But I'm sure you've also enjoyed the uninterrupted conversation. So on behalf of Mombi Njoroge, who is our super producer, and Brian Amlioto, who makes us look so good on social media, we just want to wish you a very, very good night. It's 10 o'clock.